Hi everybody, it's me. Welcome to today's co-video. This is Dr. Kestler from Lorain County Community College. I'm wearing a mask today because I think masks have brought us some good news today. So I'm going to take my mask off now, but I think that the masks have brought us some good news and I want to tell you about that. Today's the 29th. By the way, this is my last episode in August. I've been doing this now for, let's see, March, April, May, June, July, August. I'm going to be starting my 6th month. It's been going on for, is that right? Yes. Yes, so we've been doing these for quite a while, and I anticipate more coming, but um, we'll um, we'll see how things go. All right, so my temperature today is 95.6 in Fahrenheit, and that is 35.3, and which is means that I can circulate a little bit. My first thing I want to talk about is the Ohio alert system, and it's been in existence for a while, but I want to just show you the data, and I think a lot of this data belongs to the goodness of this data, the fact that things seem to be working out, is the fact that masks are working out. Masks are a good way to control this infection. In fact, that's most likely how a lot of places in the world, including China, have done it already and put it in the past tense. But I have here a little map of Ohio. There's 5 time points on here starting in July 30th. And you can see the number of red where there's a high alert, not quite the purple, which is the highest. We've never gone to that far. But you'll notice that Lorain is still on the list as of the latest reading here. But overall, we're down to 6 counties. And I think that could get better. And I think that large extent has to do with all of you, with probably also closing the bars a little bit earlier in this state, which was done, and you're doing a good job. Just to reiterate where things are, we are at 26 million cases worldwide. That is 838,000 deaths. Lives have been lost due to this infection. In fact, we know now that that's probably an underestimate. In the United States, we're talking about close to 6 million and 180,000 lives. In Ohio, you'll see that we have done a pretty good job in the beginning. Our initial phase is much lower than it is now, as it is for most of the country. I want to shift gears a little bit and talk about colleges and schools and opening back up again. One of the things that you can see from this image here is about testing sewage. I presented that a few months back that they were doing these kinds of tests, and University of Arizona feels confident that they were able to avoid an outbreak, a major outbreak, because they detected cases early on. Not sure if that's going to be actually borne out in the data when we finally analyze everything, but nonetheless, this remains an important way of determining whether there's going to be an outbreak, because it does not seem that testing is doing a great job at helping us figure out how to avoid this. Testing is we're better off reporting self-exposures and isolating ourselves is the best way to go at this point. We also are faced with, this is the end of August and the beginning of September, and of course colleges are opening back up again. And there are many colleges. I mentioned in an earlier co-video that some have already shut down. Notre Dame had shut down for 2 weeks. They're about to open up Monday, again, live. And there is going to be some activity going on in colleges, I suspect. And that is, you've got parties and stuff like that going on, fraternities, sororities, and outbreaks going on. We're pretty good at documenting these kinds of things. And I had a thought about all of this, and I'm in higher education, and I think about a lot of higher education. And I was also thinking about this show. What is that? Big Brother. And there's a whole bunch of reality television shows that are similar to that kind of concept, where you have a closed group of people, and they're living in a community, and they're quarantining. In essence, that is a quarantine situation. They can't leave. They're filmed 24/7. That's not my important thing, but I got to thinking this might be a model for colleges to use in the way that they teach. We might have to teach differently in the future. And I think one of the things we could do is we conceivably get these learning communities where people are in one building, and then professors could travel to the building and do the lessons that way. Instead of moving the kids around campus and intermingling with each other, they could stay with one group. And I'll tell you this, I came across this week. The report from the Centers for Disease Control put out this story, and it was quite fascinating. About, I think, 1,000 kids went to camp this summer in Maine, and they were able to control any outbreaks. It did not break out of the camp. It did not break out within the camp itself. So they were able to control it, and they did something very, very interesting. First of all, they found infectious people before, and they had them delay their coming to camp. So if let's say I test positive, I'm going to camp this summer. I test positive. How about you come 2 weeks later? Secondly, everybody got put into a camp by themselves. So campers were quarantined in individual camps, individual buildings with other groups for a 2-week period of time. And then they were testing people. They managed to run this thing all summer long without any issues. And I think that is something that we all can learn from going forward. So we are very social beings, and we need that. And obviously, students in college need that. I am not such an old fuddy-duddy that I don't think that is necessary. But at the same time, I think we can figure out new ways of delivering that kind of an experience without having exposure of spread of the disease. And then perhaps after the first few weeks of school, in that kind of environment, if there is no exposure, we could continue to allow the campus to intermingle at that point. Just a thought, and I thought that was a very interesting paper. All right, I'm going to stop right there, and I want to to tell you all to be good to each other, and that means wearing a mask when you go out in public. And may you all persist like a lentivirus. Thank you, and have a great weekend.